welcome to the first afternoon session on the the main stage for WAF 2022. And it's my very great pleasure to introduce and welcome Jean Ma to talk about the implications of the concept of Together, the overall theme for the festival, in relation to healthcare design, which is her area of expertise. She is the head of healthcare design for Perkins & Will, who do a lot of complicated medical buildings in the United States and across the world. I remember some years ago, one of Jean's colleagues, Ralph Johnson, talking about a healthcare facility in Kenya for eye surgery, I think. So it's not always in countries that have massive resources to allocate to healthcare. Anyway, about 2 years ago, when we were doing an online event, Jean and Ralph gave a fascinating talk about trends in healthcare design. And when we were thinking about the theme of Together, some of those themes seemed very relevant to Together. How do you use the fact that almost everyone needs healthcare at some point, and sometimes more than one point during their lives? So everyone has an experience of healthcare. Sometimes it's more to do with visiting friends and relations. Sometimes it's a matter of life and death, quite literally. But it's also, and this is a point that came through very clearly, was that you've got several layers of community involved coming together, notably the patients and the practitioners. And the practitioners are a community who have to come together. Sometimes a number of them have to work together to save someone's life. And those people also need some sort of consideration. They're living under the most, or working under the most extraordinary pressures, time, emotional, sometimes physical as well. And the way Jean and her colleagues at Perkins & Will were thinking about how you deal with that sort of end of healthcare design, as well as how do you measure the patient's experience, was something that we thought was extremely important. So please welcome Jean to the stage to tell us about Together and healthcare design.
Thank you, Jeremy. And good afternoon. It's a pleasure to be here in person after 3 years of Zooming and Teaming and Blue Jeaning and whatever else. So as Jeremy said, we're going to talk about what Together means in health. And 3 years ago, almost exactly, LA, where I live, shut down. We went from congestion and people and cars everywhere to nothing, to silence and to quiet. There were nobody on the streets and nothing much was happening. We're all quarantined at home. But in the healthcare arena, it was a completely different story. Everyone was working in a condition of chaos, of stress, anxiety, and fear, because this was an unknown situation. This is a time, certainly in my lifetime, one of the only events that has affected the entire world at the same time in more or less the same way, including our healthcare facilities. These sites of tents, the blue tents, the white tents, indoors, outdoors, were all over the news every day for years. And this is a scene in Chicago at our Rush University Medical Center, where the ambulance garage was converted into a patient care and triage area with tents. You can see the building, which was designed and opened in 2011. So it was 10 years old at the time the pandemic struck, and had an emergency room that was specifically designed to accommodate disasters, pandemics, and other sorts of events. So the first floor of the building allowed for the garage, which you see at the top of the plan in the blue, to be converted to patient care and triage. And then the main lobby of the hospital, which is shown in the tan color on the left-hand side, was converted also into patient care, as you can see in this photo. So on the left is the lobby, a normal situation, and on the right you can see how it has been set up overnight with partitions, equipment, and staff to handle the patient care. And another view of the same lobby space. And all of this was made possible to overnight conversion because we had the foresight with the client to design both the garage and the lobby with medical gases, with emergency power, with data connections, so that it would be available in the event it was needed. These were hidden behind panels and columns and in walls, so on a daily basis, no one knew they were there until they were needed. So what did we learn from the pandemic about what is important in a health setting? And it's really about the people. So for every nurse and doctor that we all see and relate to, there are dozens of other people who support them and with whom they rely. So that's everyone from other care team members to those who work in the back of house, the service, logistics, administration, etc. But they all need to be on site. And that has led us all to knowing about burnout, about anxiety, about stress, about long hours, and mostly in the context of the global shortage of health workers. This is a startling projection that in 2030, which is only 8 years away, that there will be 18 million openings for health workers globally that we are going to have challenges filling. And in that context, nurses, who are the frontline workers in healthcare, are suffering from burnout. They have all the symptoms of anxiety, stress, and burnout, and at least half in the US are considering leaving the profession, which will add then to the shortage of health workers already predicted. And this is not a phenomenon of just the US. This is actually happening all over the world. And you can see by the size of the dots and the deep color of the green where it is most prevalent. But pretty much in Latin America, in North America, Europe, and Asia, it's about the same percentage of staff who are suffering from burnout. And what does that mean? You know, when our nurses are suffering from burnout, it means that they underperform, there's more sick days, and there's more frustration. And again, depending on the statistics and who's doing the survey, 20 to 50% want to leave their jobs. In the US, we already have a shortage of 1.2 million health workers and nurses, and the statistic of people wanting to get out of that profession is at least half. So what causes burnout? There are many, many different factors, most of which are managerial, operational, or administrative. So we, as architects, as planners, as designers, have very little influence over what can be done to improve those conditions. But poor work environments is also a major factor in frustration, in productivity, and in wellness. So we can affect that through design. And many people say AI and robotics will definitely improve productivity and take some of the repetitive tasks out of the workday for our nurses and our frontline workers. But here we are talking about space. and how we can create a better environment that's supportive, that respects, and is tailored to the people who work in healthcare. Not that we deprioritize designing for patients and their families, but that we actually focus more and equally on the people who work in healthcare. So we are creating quiet rooms, wellness rooms for respite for our staff. We're creating break areas that have art, daylight, views, and are clearly for staff only. And we're creating spaces that include nature, views, and outdoor. And as we know from the pandemic, the outdoor space is highly, highly valued, regardless of the climate, because people do not want to be inside all the time with other people, breathing recycled air. So some of the trends that we're seeing and that we are incorporating in our facilities include ways in which we can create clarity and separation. How we can plan in intentionally plan in boundaries so that there are clearly areas for patients and families and the public, and then there are private spaces for staff only. And we have some projects as illustrations of how we've incorporated that. For a private hospital in Saudi Arabia, we are just now completing design. And this client and this facility is focused on the human experience. First and foremost, that is the priority, that the experience should be as calm and seamless and convenient as possible. These are views of the lobbies. So you can see it looks more like a hotel and a resort than a hospital. But the important thing is that in the planning and in the design of the facility, that there's clarity of what is public and what is private space. So on every level, the tan space represents the public realm. This is where anyone, patients, families, visitors can circulate, including dedicated elevators and corridors. This is true on every floor of the facility. Everything shown in green is the back of house. This is private areas for staff only or for patients who are interacting with the staff. So on the typical bed floor, you can see that we are able to zone according to public space, semi-private space, private space for staff shown in the green, and then the real private space that is the respite area, the staff break room, the sleep rooms shown in the pink. So there's always a clear separation, which creates the correct environment for families and the patients in quiet environments. And then the green areas allow for privacy, for staff interaction, without compromising patient privacy of information in hallway conversations and overheard phone calls. So you can see some of the renderings that illustrate these spaces, the arrival area for families, the dedicated staff areas and back of house with their own elevators and stairs. So the vertical circulation is separate and private as well. And then the super private space where we have the break room, the quiet rooms, the lactation rooms, the locker rooms, etc., that is for staff only. And even on the administrative spaces, we are experiencing a culture change of going from private offices for everyone to open collaborative workspaces that offer the opportunity for teamwork and for collaboration and long-term flexibility in how the space is used. At the Duke University Medical Pavilion, we incorporated similar concepts You can see the patient rooms in the blue, the public family area circulation in the tan, and then again the staff areas in the back of house in the green with their own elevators and their own stairways, so we can encourage staff to use the stairs for wellness purposes and be behind the scenes. And then the pink area representing the staff support spaces, again, separated from private, clear boundaries, separated from the patients and their families. So again, you can see how this works and the type of spaces that have been incorporated. Within the outpatient environment and the clinics, the US model is quite different than most of the rest of the world in that we have an insurance-based, revenue-based business model. So the clinics are actually getting larger and larger and funneling through more patients, and most of the physicians now work for the insurance company or for the hospital, which didn't used to be the case. So being efficient in the way patients are processed through makes a huge difference, but it also creates more stress on nurses and doctors to cycle patients through quicker and more efficiently. So the ability to interact between the patient and the caregiver is increasingly important. This is a renovation project in an office building that we did for Kaiser Permanente in California. And you can see it does not look like a clinical environment, which is the plan, and to encourage people to want to come to see their doctor and want to stay after their appointment for education, for supportive services, etc. And then using the same color coding system, you can see that in this model, the idea is that the staff interaction with the patient in the blue areas is much more visible, all on stage and accessible to the patient, so that there's communication back and forth during each visit. The green area represents the separate staff zone that is for team collaboration. So again, the public space that you can see with the arrival and the waiting, and then the semi-private space that you see with the caregiver team and the patient areas clustered in the typical modules, and then the collaborative space for the staff to work off stage. So this is private. Patients are not allowed, visitors rarely allowed, so that the stress and the anxiety of being available to patients all the time is taken away. And for a community hospital at Altaview, this is a different model in that the staff are completely separated from the patients in the green area, and the blue areas represent the exam rooms. So again, we have the public in the tan, where the waiting and arrival check-in occur, but then each of the blue rooms, where the exam room, where the interaction takes place, has two entrances, one for the patient from the tan corridor, one for the staff from the green work zone. So the only place where the patient and the staff interact is in the blue exam room. Otherwise, the staff are invisible to the patient. And then the pink area represents the break room and the staff-only area that's completely behind the scenes. So again, you can see the arrival and circulation for the patient, and then the work areas for the staff behind the scenes, totally private. And the staff area. And in Ohio, at the University of Cincinnati Gardner Neuropsychiatric Center, we have a similar concept where the staff interacting with the patients are readily available to the patients in the blue zone, and then a private collaborative space for internal work beyond. So you can see that the exam rooms are clustered around the staff who interact with the patients, but the staff who need to do heads down work or make phone calls or follow-up work can work in the back in the green area. And that has been extremely successful and has helped the doctors. This is the first clinic designed for their physicians using this model, and they are more productive than they were in their old facilities because of this change. And we don't want to forget how we design for families and patients. This is the Memorial Sloan Kettering Cancer Center, and this is a renovation in addition to an existing office park where we created a new arrival sequence with outdoor gardens and connections for the families and the patients who, as you know, in cancer centers come repeatedly. And you can see the clinic area in the blue and the green, but the notion of choice for patients and families to choose where they want to be and how they want to spend their time before and after their appointment. So we've created a variety of zones that include different types of furnishings, different lighting, finishes, and scale in order to give people choice. So they can have active waiting or they can have more quiet, meditative waiting spaces, all connected to an outdoor garden. So this is a view of the outdoor garden and one of the waiting spaces. So again, coming back to what is it that we can do and what are we designing for in our current and future projects. And the biggest issue in the US and the rest of the world is recruitment and retention of clinical staff. The ability to differentiate through operations, management, benefits is all outside our realm of influence, but we can design facilities that allow our clients to be more competitive in recruiting physicians and nurses by including the kinds of spaces that support their well-being. So in order to accommodate that, we've obviously are designing more ergonomic, better acoustics, better lighting to improve the work environment. But we're also now advocating with our clients and to our clients on behalf of staff to design well-being and wellness spaces into each facility. And these are not revenue generating, which in the US is the number one criteria for space in a hospital or a clinic facility. But to the extent that they can influence the ability to recruit or retain key staff, this has become an investment that's essential. So some of these spaces include designing break rooms and lounges and outdoor space that are dedicated to staff that give them the best views, the best daylight, the best location in the facility, that give them the ability to get away from their immediate work environment and be able to relax and to enjoy spaces that are more comforting. The indoor, outdoor, having access to nature and daylight. Again, outdoor spaces are becoming the most important thing in any building. Fitness centers that are dedicated to staff only. We're using massage rooms, wellness spaces, yoga studios to provide self-care for patients, for the staff, quiet rooms and respite areas, and then that indoor-outdoor space that is for staff only. This is a rooftop deck at Spalding Rehab Hospital in Boston, and this is a space dedicated just for staff. So these are all ways that we as designers and planners can influence the outcomes for our clients in being able to design for the people who work in healthcare on a daily basis and rely on the environment to not only support their productive output and their ability to provide quality care, but also to take care of themselves and to be well, both physically and mentally. So with that, we're ahead of schedule.
Well, Jean, thank you very much for a fascinating talk. Do you want to sit down?
Sure.
We can have a conversation. So, one of the things I've written down here is nuanced togetherness. That, around healthcare brings people together of necessity. And, lots of people don't choose that. Even those who are working there, it might be the career that they set on some time ago, and they might want to leave the profession, but they find it quite difficult because they wouldn't necessarily get another job. So,
Because you're wrong side.
Oh,
okay. All right. But then it's how you bring people together, all of whom are vital to the success of the overall treatment, in this graduated way, I think is really interesting. And in some ways, it's a non-hierarchical way of doing that, although, on the whole, the staff will have the upper hand over the patients, I guess. But it's how can you bring these different communities of people together in a way that allows the most beneficial interaction to occur?
and by community of people, you're talking about all people?
Yes, I'm talking about I suppose it's several different communities, the healthcare providers and the patients, and then sometimes the patients' families or friends or whatever. And I guess there are administrators as well who may not be medically qualified, who are just managers. So all of them have a role to play in the success of the overall facility, but somehow they have to be given their own space in which to work.
So in the design of our facilities, we're creating a zone that's between totally public and totally private. And those in-between areas now include community rooms, classrooms, to some degree demonstration rooms, and education facilities that are open to the community and open to the public as well as to the staff. And some of these include nutrition classes, physical exercise classes, but demonstration kitchens have become very, very common in the US because we, as does most of the world, suffer from diabetes, obesity, and heart disease. So being able to teach nutrition, healthy eating, and demonstrate that brings the community into the hospital and engages the patients who are in treatment, but also the general community as well.
And so it's about lifestyle. It's like the staff might have access to a gym, as you showed. Patients might be given advice on diet or nutrition, I guess, which is quite interesting. Also, when you have these private spaces for the healthcare workers and they go there to relax, and it might be just a few minutes of downtime before they have to go back, is there any sense that they may have casual interactions with other colleagues that might help them in the sense that, one of the things around research, at least, is that these casual interactions between people who may practice quite different disciplines, but can unlock a problem in one field just by saying, well, in another, this is how we deal with it. Is there any sense that those sorts of casual interactions that might take place in those private staff areas might benefit the treatment that can be offered?
Yes, that collaboration and the ability to interact with more people who are not in your day-to-day, moment-by-moment work area is what we illustrated in the green color. Those collaboration zones are getting larger and larger to accommodate multidisciplinary teams, to accommodate support people as well, so that everybody's together and you have the ability to reach out at any time because they're right there with you, as opposed to having to make an appointment, make a phone call, or go somewhere else. So that has improved the collegiality and the collaboration for healthcare workers.
Yeah. And this morning in the WAF series, we saw a presentation by some of your colleagues from Penoy and Prasad, which is a studio within the Perkins Will office in London. And it was for the reconstruction of the Moorfields Eye Care Hospital on the new site in central London. And one of the things about that was that will include education and even sort of museum facilities. So there'll be a museum of the history of eye care or whatever it is. So there could be reason for the public to go there, even if they're not actually getting treatment. And so, in a sense, that I guess turns a hospital into a more general part of your life experience than when you just have a problem with your eyes or whatever it may be. Is that something you're able to do? I mean, because you talked about there being some, particularly at Rush, I think there was some, more general facilities. Is that something that you're beginning to incorporate into other healthcare facilities as well?
Yeah, I think that hospitals and healthcare environments have become civic buildings and community centers. So the outreach and creating opportunities to engage with neighborhoods and the city at large on the campus has become a goal of ours and our practice, but also something we're encouraging our clients to break down that barrier between the community and the hospital. So some of the ways that our clients have incorporated this are through farmers markets, again tied to the healthy lifestyle choices, that we're including libraries in some of our facilities. So again, there's a way to come for education, more retail that's targeted toward healthy eating choices with cafes and restaurants and to-go meals, both for our staff, so they can stop and get a takeout when they go home and have a healthy meal as opposed to stopping at a fast food place on the way home. But these are the kinds of facilities that we're building in our community hospitals, but also our academic medical centers.
Yeah. And I suppose one of the things that Perkins Will, I understand you is you undertake quite a lot of research yourselves and you sponsor research. And I think particularly in neuroscience. Could you say a little bit about how those research findings inform the way you design buildings?
Yes, we obviously utilize and contribute to evidence-based design, which informs the design of our healthcare facilities, both for patients and their families, but also for staff. And I will say that most of the evidence-based research has been focused on patients and outcomes and the quality of care, but with the demands on our staff, there's much more research going on now about productivity, burnout, and the ability to have good decision making because the worker is calm and stress-free. So in our neuroscience research, we have a human experience lab within Perkins and Will, which is led by PhD educated staff, and we work with neuroscientists, such as our client at University of Cincinnati and at other facilities, and we have identified research topics around daylighting, around perception of finishes and colors, as well as the spatial context for people who are cognitively challenged. So in the image that I showed of the University of Cincinnati project, you can see that the facade is actually a fabric scrim. And it serves several purposes, one of which is to manage the heat gain and the solar gain on the building to make it more energy efficient. But the second and more important reason for the scrim is to diffuse the direct daylight on the interior so that the patients who are neural challenged patients, either physically neural challenged or cognitively challenged, so that there's no glare, there's no silhouetting of people against the window, so they're able to actually see clearly their pathways, but also their provider. And it takes away distractions, which for neuropsych patients is a key factor during their treatment.
Yeah, so in some ways, when they go to one of your hospitals, they'll have a facility, or they'll have an environment that is much more comfortable for them than in a general environment, because of the design features you've built in that will suit them. So in other words, you're setting a new standard for, as it were, general public buildings, which I guess could be quite easily repeated in other public buildings.
Absolutely, and I think this is one of the times when I feel that the thing I've been saying for 20 years has finally become common, which is that the more things change, the more they become the same. So these design features and the spaces and the functions that we're building into our hospitals and our healthcare environments are also what's happening in schools, in higher education, in civic buildings and cultural buildings. So now we see high schools that have clinics within them, but you really can't tell the difference from a design perspective. Or we see libraries inside hospitals. Again, they look and feel like a library, but they're inside one of our healthcare buildings. So I think the idea of health and wellness being an integral part of every community and being welcoming to everyone is the direction we want to go.
And it's interesting because it's actually challenging the way in which architects think about building types, I think, is what you're saying. So just to finish then on Rush, which you started with, I'm sure you know, but Rush won the healthcare category in WAF. I can't remember in which year, but some years ago. And it was a absolutely clear winner because there's something heroic about its scale and heroic about its ambition, which I think was communicated very well by Ralph, who presented it. But it's interesting to see how it's actually worked in action. All those things about reusing the garage or using it for a different purpose, about the way the foyer could be broken down to provide different types of treatment, particularly for an infectious pandemic. And the design has stood the test of time and it's delivered, which I think is a testament to the embodied expertise in healthcare design that you've built up at Perkins and Will. So, Jean, thank you very much for discussing this. And let's all say thank you to Jean for a great presentation.